What do you know about bile stasis? Today we'll talk about 4 important aspects of this problem: the causes, dangers, symptoms, and treatments. Why does bile stasis occur? Bile stasis is a situation when it stops coming out of the gallbladder or comes out in insufficient quantities. This occurs for the following reasons. First, due to abnormalities in the development of the gallbladder and ducts, as well as acquired problems in the form of cysts and stones that block the ways of bile outflow. Second, because of the consumption of fatty foods and alcohol and an irregular diet. Thirdly, the outflow of bile is negatively affected by a sedentary lifestyle. The fourth reason is a thyroid gland malfunction, which changes the very composition of bile and it thickens. And finally, an important reason is stress. They lead to spasm of the bile duct muscles, which blocks the outflow of bile. How does bile stasis manifest itself? The first symptom of this problem is a bitter feeling in the mouth. This is the taste of bile, which is taken into the stomach. The second sign is frequent belching. It is important that with bile stasis, belching occurs without connection to the consumption of a certain type of food. Symptom number 3 is heartburn. Burning in the stomach shows that the process of digestion of food in the stomach, which is also affected by bile, is disturbed. The fourth sign of bile stasis is pain in the right subcostal area. At first, it is mildly aching or just a mild discomfort. But over time, the pain intensifies and manifests itself in acute attacks. The fifth symptom is bloating. Increased gas appears due to imbalance of the intestinal microflora and insufficient digestion of food. Sign number 6 of the disease is nausea. As in the case of belching, it is not associated with poisoning by poor quality food, and can occur even outside of the eating process. In extreme cases, such attacks of nausea end with vomiting. In the absence of treatment of bile stasis, a person feels constant weakness, irritability, and drowsiness. In especially advanced cases, brittle bones, weight loss, jaundice of the skin and eye membranes, as well as darkened urine and discolored feces develop. How is it dangerous? The composition of bile requires it to circulate regularly. If there is no flow, the bile thickens and some of its constituent elements precipitate, which eventually turn into stones. An accumulation of bile in the bladder leads to its inflammation and the development of cholecystitis. When the gallbladder is not able to hold the entire volume of accumulated bile, and it does not go to the duodenum, the backflow of bile into the liver begins. This is a very dangerous condition, because it provokes toxic poisoning of the liver and can lead to hepatitis and cirrhosis. Given the important role of bile in the assimilation of nutrients, when it stagnates, all metabolic processes are disturbed. This leads to avitaminosis, weakening of the body and its immune system, brittle bones, and imbalance of intestinal microflora. At the same time, cholesterol levels in the blood rise and atherosclerosis of blood vessels and heart disease begin to develop. How to treat bile stasis? The first thing to do is to normalize the diet. You will have to give up fried and fatty foods, including fatty meats. It is also necessary to get rid of bad habits. From your diet you need to exclude smoked meats, legumes, carbonated beverages, and any products that contain oxalic acid. Instead, you need to increase the intake of healthy fatty acids. These are found in vegetables, linseed and olive oils, and fruits. Among meat products, choose lean varieties and replace meat with fish more often. It is important to eat small portions 5 to 6 times a day and drink plenty of water to ensure that the bile is not too thick. In advanced cases of the disease, of course, diet alone will not solve the problem. Evaluating the condition based on the results of examinations, doctors decide on the choice of methods to eliminate bile stasis. The easiest variant is the prescription of drugs that improve the flow of bile. But in neglected cases, this is not enough, and it is necessary to resort to surgical intervention. To remove stones or dilate the bile ducts, laparoscopic punctures are used, and in critical cases, the entire gallbladder has to be removed. This method is resorted to when it is completely clogged with stones, and its normal functioning cannot be restored. In order not to bring the condition of the gallbladder to such a critical stage of the disease, you need to closely monitor your condition. If you note any of the above symptoms of bile stasis, do not put off going to the doctor until later. Timely diagnosis allows you to normalize the function of the gallbladder with the help of diet and simple medications. Have you faced the problem of bile stasis? How have you solved it?